Hello, everyone. Welcome to our webinar on Medicaid School-Based Expanded Access. First, let me introduce everyone. Our two hosts will be Lindsay Kimbleton.
Hi, everyone.
And myself, Stephanie O'Connor. We both work at Kentucky's Department of Education on the school-based Medicaid programs. Next, Ms. Lucy Sinners from the Department of Medicaid Services is joining us. She coordinates the Medicaid school-based programs for DMS. Last but not least, Ms. Thelma Hawkins. Ms. Hawkins is a branch manager at KDE and oversees the Medicaid school-based program. She will be assisting us with questions and an application demo. We encourage everyone to ask questions throughout this webinar so it can be most beneficial to your school district. There is never a bad question, so please don't hesitate to ask. All questions need to be emailed to the email address listed on the screen. They will be monitored and answered periodically throughout the presentation. We hope you will join us on this exciting adventure in Kentucky that will benefit the health of all students.
All right, guys, let's get this started. I'm going to start the PowerPoint. All right. All right, so what is expanded care? On December 15th, 2014, the Center for Medicaid and Medicare Services, also known as CMS, sent a letter to the states issuing guidance in regards to free care. If you would like to see the 2014 letter, please refer to the link on slide 5. The goal of this new guidance is to facilitate and improve the access to quality healthcare services and improve the health of communities. This guidance allows school districts to bill for services outside of the IEP.
So, what does this mean for Kentucky? On April 28, 2019, the Kentucky Department for Medicaid Services, otherwise known as DMS, submitted an updated state plan amendment, also known as a SPA, to CMS to include expanded access in Kentucky. CMS approved the state plan amendment on November 4, 2019. This updated amendment allows schools to potentially bill for services that are provided to Medicaid-eligible students and are medically necessary. However, these services must be available to all students, Medicaid-eligible or not, at no cost to the student. The link that we have provided will show you the approved state plan amendment for Kentucky. Please note that this SPA was retroactive to August 1st, 2019. Don't get too excited. Several conditions must be met in order for schools to bill responsibly.
Medicaid reimbursement for the schools. One of the most common questions we are asked is how much money will our district make? This is a very complicated answer and will take a couple of years for the schools to get the full picture. While all of our time today will be spent on the School-Based Health Service Program, which is also known as Direct Service Program or Fee-for-Service, just remember that all three Medicaid school-based programs work together to give the school reimbursement for their services. The Direct Service Program is where the school district will receive the most of its reimbursement. You can expect to see a small amounts of reimbursement throughout the year for these services. The School-Based Administrative Claiming Program, also known as SBAC Program, is the next program to receive the most reimbursement. And lastly, the Cost Report Cost Settlement.
Before we get started explaining the ins and outs of the school-based health service program, let's give a basic overview of the other two programs. The school-based administrative claiming program, more commonly known as SBAC, operates using a time study methodology. As one of our vendors always says, the SBAC program are the bookends. The direct services such as speech, OT, PT, nursing are the books, and the time spent before and after the services is what makes up our SBAC program. This program allows the schools to get reimbursement from administrative activities such as Medicaid outreach, Medicaid service program planning, and policy development. Just a reminder, this program provides school districts with quarterly reimbursement. Also, please know that the SBAC guide will be updated for the upcoming school year to include our expanded access portion of the program. We will give more details and trainings on these changes in the upcoming school year.
The cost reporting cost settlement started in 2008-2009 cost report. This is an annual process ensures that the schools and DMS settle the cost. The cost reporting cost settlement is the final piece to the puzzle and ties everything together. So let's try to break it down and see how these programs work together. Sally Jones, an SLB, has been providing services to kids within the district. Every time she provides a Medicaid billable service, Medicaid gives her a small amount of reimbursement. Her district receives $5,000 for her direct services. Her district listed her on the KDE annual application and listed her in the direct service staff pool list in the random moment time study. The following school year, it's time for the district to complete the annual cost settlement. KDE supplies the cost settlement vendor, otherwise known as Fairbanks, a list of all the practitioners included on the direct service staff pool list in the random moment time study. Since Sally was listed correctly in the direct service staff pool list, her name appears and the school district can count her cost. That fall, the cost settlement shows that it actually cost the school $10,000 for her services and they only received $5,000. So Medicaid gives them a check for the additional $5,000. Now let's reverse it. Sally Jones has been submitting claims each time she provides a Medicaid billable service. The school receives $5,000. They forgot to include her on the direct service staff pool list in the random moment time study. So the following year, her name does not appear on the cost settlement and they cannot count her costs. Now the district owes $5,000 back to Medicaid. This is just an important reminder to always include all your billable practitioners on the direct service staff pool list in the random moment time study.
Last but not least, let's talk about my favorite program, School-Based Health Services. This program is the easiest to understand. Basically, if a Medicaid eligible child receives a service such as OT, PT, speech, mental health, then the school may be able to submit the claim to Medicaid for reimbursement. The school should be receiving small increments of monies throughout the year from this program. Make sure to check out your remittance advice on Kentucky Health Net. This is a receipt for all your claims submitted and should be checked frequently. Your billing agent can help you with this. Please note that this webinar today will focus on the nuts and bolts of this program and hopefully give you a clear, basic understanding of what the expanded access program will look like in Kentucky.
Several requirements must be met before a school district may request reimbursement from Medicaid. First things first, the child must be Medicaid eligible. Just remember, kids go in and out of Medicaid eligibility all the time, and it's best practice to get assigned parental consent on all kiddos. Don't worry, we will cover more details about the parental consent in a few minutes. For the traditional IEP program, the service must be listed in the IEP. In this case, the IEP deems medical necessity. For expanded access, it must be considered a medical necessity. Last but not least, make sure the practitioner is on the KDE SBH annual application and is not being paid 100% federal funds. If a practitioner is paid 50% federal and 50% non-federal, only submit the non-federal portion on the cost data sheet to your billing agents.
Medical necessity has always been a hot topic. Currently, with the IEP program, as long as the service is listed in the IEP, it's deemed medically necessary. That's all about to change. But don't worry, we will guide you through this process. Right now, we know that a service must be medically necessary in order to bill Medicaid. CMS defines medical necessity as services that meet accepted medical standards, or items reasonable and necessary for the diagnosis or treatment of illness or injury or to improve the function of a malformed body member. The most important thing to remember is to keep backup documentation. Backup documentation may include, but is not limited to, detailed progress notes, evaluations, test reports, consultations, and records from other healthcare providers. This is a basic definition, but over the next couple of months, KDE will be working on more examples and specifics regarding medical necessity. Just hang tight and we will learn this together.
Here are two examples that meet medical necessity. Example 1, a school conducts a screening for all students. The school may be able to bill for Medicaid eligible students. Example 2, Johnny goes to see the nurse. Since he is Medicaid, the school may be able to bill for his visit with backup documentation. These are two of many examples. This program opens the doors for so many possibilities and will hopefully provide the schools with additional reimbursement for the services they are already providing.
Now let's move on to parental consent. Parental consent is required for both IEP and expanded access services. KDE and DMS have made a dual parental consent that covers IEP and expanded access services. Schools must use the standardized parental consent sign that KDE has provided. It may not be altered in any way. Signed parental consent must be obtained one time as long as the student is continuously enrolled in your district. If a child leaves your district for any amount of time, the district must get a new signed parental consent. Just a reminder, districts may not share parental consents. Also, once the signed parental consent is received, the school must give out an annual notice every year that they will be billing Medicaid. Also, the dual consent does not void the previous IEP parental consent. Unfortunately, sometimes parents will not give schools permission to bill. When this happens, the schools cannot bill Medicaid for that child. On the KDE SchoolBased Medicaid website, there is a parental consent brochure and the dual parental consent in English and in Spanish.
Parental consent is one of the major core components of Medicaid billing. It is very important for schools to have policies and procedures in place to ensure every child that is billed for has a signed parental consent. For example, Sarah is in the 8th grade and she has been continuously enrolled in your school district since kindergarten. The signed parental consent from kindergarten was misplaced. Technically, DMS could recoup every claim that was billed for Sarah. In order to avoid this, we strongly encourage the following. Number 1, have an electronic copy of all signed parental consents. There are many ways to do this, but a lot of districts have had success uploading the parental consents to Infinite Campus. Number 2, it is recommended that the dual parental consent is sent out to all students to be signed. This would allow schools the flexibility to bill expanded access at any time. Also, Medicaid eligibility is continually changing. If a parental consent is received on all students, then the school can bill as the student becomes Medicaid eligible. Number 3, send dual parental consents home in the registration packets. This would allow the schools to ensure every family has been given a parental consent. And number 4, have written policies and procedures regarding parental consent. Having everything in writing would allow every school district practitioner and employee to follow the appropriate procedures and make sure all of your I's are dotted and your T's are crossed.
To wrap up parental consent, here is a copy of the dual parental consent that schools must use to participate in the expanded access portion of the program. Please know that this parental consent does not void out the current IEP parental consents. Also, schools must use this parental consent and once again may not alter it in any way. Please remember that parental consent is only valid from the date it is signed. This form can be found on the KDE Medicaid SchoolBased website. We will provide the link at the end of our presentation, and once again, we will have both English and Spanish versions available.
Here's an overview of some of the services that will be covered by the Expanded Care Program. Currently, speech services are the most utilized services in the school districts. With Expanded Care, DMS has now expanded their practitioner list and will include providers such as school psychologists, licensed professional art therapists, and several more. We hope that this will allow the schools to get additional reimbursement for the mental health services they are already providing. For example, little Beckett's parents are going through a divorce and he needs help dealing with his emotions. He now goes and sees a counselor every week. This may be billable with expanded access. Also, expanded access will potentially allow schools a chance at getting additional monies for services their school nurses are currently providing.
Here is a quick representation of the services that schools bill in our current IEP program. Please note that not all these services on this chart will be available for expanded access. Of course, speech services are the most utilized service in the school district at 52%. Then transportation is at 16%, and occupational therapy comes in third at 15%. Unfortunately, with the current program, mental health services are only at 1%. We expect that with the program expansion, that will include a new expanded list of billable practitioners and services, nursing and mental health will be highly utilized services in the school district.
Most of the services, minus a couple of exceptions, may be billed in either individual or group therapy. Please remember that when billing group therapy, the group can only consist of 6 kids or less. If you are working with an IEP student, please remember to write small group or individual therapy in the IEP. KDE recommends it being written in the Supplemental Aids and Services, or the LRE, least restrictive environment. By putting this statement in one of these sections, it umbrellas all the services listed in the IEP. Please note that all services provided prior to June 30th, 2020 will be paid via the Medicaid's physician fee schedule. Also, more importantly, prior to June 30th, practitioners cannot provide both IEP and expanded access services. Starting the upcoming school year, practitioners will be able to provide both IEP and expanded access services, since expanded access services will be incorporated into the random moment time study.
Okay, we have a couple questions, so we're going to go ahead and answer those. Remember, you can always email us questions throughout the presentation and we'll be sure to answer them. The first question, do we need to get this new form signed by everyone already set up for billing? So if you are planning on participating in the expanded access portion, then yes, you would need to get this form signed by all the kids in your school district. If you're going to just stay with the traditional IEP portion of the program, then no, you will not need to get this new one signed. We have one more question. We do online registration in Infinite Campus. Could the Medicaid consent be a part of online registration? Would an electronic signature be legal? So that's a great question. We have asked the Department for Medicaid Services, and they are currently looking into that to see if we can allow parents to do an electronic signature on the parental consents. As soon as we hear back, we'll be sure to communicate that to the school districts. Okay, we're going to continue on. Evaluations. The good news is that evaluations are Medicaid reimbursable, and most schools do not take advantage of this. You may bill all parts of the evaluation, including the testing, observation, and writing the report, as long as it's done during the normal school hours. Please note that during COVID-19, DMS has said that services provided outside the normal school hours are reimbursable. Evaluations must be billed the exact times they are provided. If you're providing an evaluation for Aubrey and you observe her on Monday at 12:30, test her on Wednesday at 10, and then write the report on Friday at 2, you will need to bill these exact times on the days they are provided. Most practitioners' licensure requirements say the evaluations should be no older than 3 years.
Since the program expansion, the procedure code list has changed dramatically. While the traditional IEP program contained around 40 procedure codes, the new list contains hundreds of procedure codes. This is due to the expanded list of providers and services that the schools will now be able to get Medicaid reimbursement for. Your billing agent will be able to help you navigate the new procedure code list. Also, most procedure codes are still based on units. FYI, one Medicaid unit is equal to 7.5 minutes to 15 minutes. There are a few that will be service-based, which means they will be reimbursed for the service, not the amount of time. Please note that even if a code is service-based, a time still must be listed on the service log of when the service was provided.
Here is a quick slide that shows how the claims are calculated. Each procedure code, individual, group, evaluation, have a different reimbursement rate and a different maximum reimbursable amount. Please refer to the formula below if you would like more details on claim calculation. Also, always remember the schools provide the state match, which is about 30%. So the districts will receive approximately 70% reimbursement.
Things to remember. Here are a few important things to remember. Once again, practitioners cannot be paid 100% federal funds. For example, if a practitioner is paid 50% federal and 50% non-federal, then only claim the 50% non-federal amount. Remember to exclude all federal monies when submitting cost data to your billing agent. Make sure you include all the Medicaid billable practitioners on your KDE annual application. Please remember that all claims from now until June 30th will be paid by the Medicaid physician fee schedule. From now until June 30th, no practitioner can provide both IEP services and expanded access services. Starting next school year, practitioners will be able to provide both IEP and expanded access services since expanded access will be incorporated into the random moment time study.
Starting the 2021 school year, KDE will mandate that all schools have a KDE approved quality assurance on file. Quality assurance documents will detail out the school's district's policies and procedures for their Medicaid school-based programs. This will allow KDE to determine program shortfalls and improve future monitoring reviews. For example, we know that a school needs to get Medicaid parental consent. The quality assurance document will outline every step in that process, such as, number 1, dual parental consents are to be given out in annual registration packets. Number 2, all returned signed parental consents will go to the DOS. Number 3, the DOS or administrative assistant will put the parental consent date into their billing system. Number 4, the original signed parental consent will go into the child's due process folder, and so on. Does anyone see how this process can be improved? Remember, it's best practice to keep electronic copies of all parental consents. Schools are more than welcome to start submitting their quality assurances this year. This would allow the district a much quicker processing time and make sure the district doesn't miss the 2021 deadline. We'll be glad to help schools with these. Please reach out to us if any assistance is needed. Please know that there is a basic outline located on the KDE SchoolBased website to help schools get started.
So your district has met all billing requirements. What do you do next? We request that every school district submit the expanded access contact's name to the school-based email. We want to ensure that all communications are sent to the appropriate contacts. Please remember that even if a district chooses a new point of contact for the expanded access program, the special ed department still needs to be involved. We want to make sure that the special ed is helping guide the process because they have the most background in the program. Also, we are excited to announce the KDE SBH annual certification application will now be submitted electronically. We are going to review the new process in just a minute or so. For best practice, it's always best to keep written program policies and procedures. It allows everyone to be on the same page, list expectations, and assist training new staff. Hint, hint, this sounds like a lot like the quality assurance that Stephanie just was discussing. This is the best time to start writing everything down and making sure all program guidelines will be met. We will be glad to help you with this, just let us know. Last but not least, we all know that you can't start billing until you get assigned parental consent. This will be a huge task to undertake. Take your time, figure out your district plan, and stay organized. This is new to all of us.
We have one more question I'm going to go ahead and answer. The question is, counselors are usually listed as AP providers, so the administrative staff pool list. If we are going to bill for mental health services, do they need to be listed as direct service staff pool list? As we stated earlier, we will be having changes for our SBAC program in the upcoming school year. So you will find out about those changes, coming in the fall or so about the staff pool list. But yes, some of those providers will now be moved from the administrative staff pool list to the direct service staff pool list. Great question. Here's a photo of the 2020 application. Ms. Thelma Hawkins will demonstrate how to submit your application electronically. The new application is now available on GMap. Lindsay and I sent an email notification along with directions yesterday afternoon. Please let us know if you didn't receive it by sending an email to the school-based Medicaid email, and we will be sure to get it to you. Importantly, the application for the upcoming school year will be due by Monday, September 7th. Please remember that all applications must be submitted in GMap by September 7th. If districts fail to meet the deadline, their provider number will not be backdated to August 1st. Their provider number will be effective from the date the application is received. Also, the sooner the district submits their application, the quicker the processing time will be. Ms. Hawkins will go into more detail, but all licensure certifications must be uploaded in the order they are listed on the application. Failure to do so will result in KDE requesting you to resubmit and further delaying the process. Last but not least, the application includes a place to tell us if you will be participating in the expanded access program. Please make sure to mark the checkbox if you will be participating.
KDE has made our new GMap application more user-friendly to districts. Also, the GMap application will fulfill the recommended guidelines for Healthy at Work. We hope everyone is excited about our new process. And now let's turn it over to Thelma for the GMap navigation demo.
Hi, good afternoon. Before I start the demo, I'll just give a little background on what GMap is. So GMap is our grants management application and planning system. It's used primarily for districts to submit their federal grant applications for Title I, Title II, Title III, Title IV, Title V, Perkins, and IDEA. And we've also used it to create other reports for which we need to collect data for federal reporting. The system is very user-friendly. If you're a director of special education, you're familiar with GMap because you have to submit your IDEA application. To obtain access within GMap. You must contact your district user access administrator. If you're responsible for completing the annual application and you do not have GMap access, you will, every district, just about every district has a user access administrator, which is the individual in the district who has the rights to add and delete users for GMap. And you do not need to have access to GMap to determine who the user access administrator on the GMap homepage, which you can get to by, you can access the website by going to gmap.education.ky.gov. And if you click on KDE resources right here on the left-hand side and click on user access administrators, and this list that if you click on the list that says user access administrators by district, you just look for your district and that's the person in your district. If you do not have GMap access and you are responsible for completing the annual application, you would just need to notify that person, asking them to set you up in GMap, and they will need to assign the role of district Medicaid application update. So once they assign you the role, set you up in GMap, assign you the role, you'll be able to complete the application. So now I'll start the demonstration. So to access GMap, you just click on the sign in, and the sign in is primarily just your email address and password. And I'm logging in as the administrator. However, when you log in as a district employee, you will see your dashboard. And on the dashboard, it'll have your district name and number and some other announcements. And you won't have to use this step to get to the district document library, but since I'm using our KDE test district, so when you log in, as I said, you'll see your dashboard, and you will just click on District Document Library, then click on the year 2021 and search folders, and then click on 2021. And this is a list of all of the different folders for different submissions that districts have to submit for other requirements. So you would click on, you would look for the Medicaid application folder, and you click on the Medicaid application folder. And to submit the annual application, you would click on Edit Documents. And this template is the actual Excel document for which you usually receive by email. You click on that. Once you click on Open, it will open to the Excel document. You would then save that to your desktop, wherever you want to save the file so that you can work on the application. Once you have completed the annual application, you will then go back through those same steps and to get to the district document library, and then you would upload your template. And once you get to this page, you must put in a document name and a document description. And to make it easy, you can just call it, the School-Based Health Services Annual Application. And then you go to your folder wherever you have that document saved and upload it, and then click Save, and that'll show that the file has been uploaded. And then once you return to the district document library, you will see this is the file that has been uploaded, and it will date and timestamp when the file was uploaded and by whom. So it would have whoever's uploading it, your name. So when Stephanie and Lindsay They will run a report to see who has submitted. Well, then they would go into each district's folder. All they would need to do is just click on this link and the application would be uploaded. So that's the application part. The second step is to upload your certification and licensure. For this, your certification and licensure must be in the same order as the names of your practitioners on your application list, so that when Lindsay and Stephanie are reviewing, they can go name by name, and when they have both documents open, so that they can see the certification, the name, follow, and the certifications line up. So please just keep in mind that when you are uploading your certifications, make sure they're in the same order as the names on your application. And you click on Edit Documents under Certification and Licensure. And for this one, we do not have a template because more than likely it will be a PDF file. And so you would just upload the one file. Just go to wherever you have it saved on your desktop, and make sure you put a document name and description. You just upload it, save. This shows the document has been uploaded, and then click Return to District Document Library. And then you can come back to the application. And so under the certification and licensure, just click on the plus sign and you will see the name. It'll be, once again, date and time stamp, and it has the name of being submitted, well, created, modified, uploaded, the document. Then the next step is, this is for Stephanie and Lindsay, but then as the district, as the Medicaid director, this is where you would come to see your approval letter. So once Stephanie and Lindsay review, they will go through the process of uploading the approval letter. This will show the approval letter has been uploaded, and it will show either Stephanie or Lindsay's name. And all you would need to do is just click on this letter, open it up, and the approval letter, oh, it's example, but that's just sample, but the actual approval letter will be there for you. Okay, and it's date and time stamped. And so the process is the same. If you have to submit an amendment, they will be tracking amendments separately. And the template to, if you need to submit an amendment, you would click on Edit Documents. And this is the template for the amendment form. And you will complete that amendment form, save it to your, open it, save it to your desktop. Once you have completed that amendment form, you will then upload it in GMap. And once again, you always have to have a document name and a document description. Upload the amendment form, come back to the document, district document library under. And so this is the amendment form, which you just uploaded. And then for your certification, any of the certifications that need to go along with the amendment form, same process, just click on Edit Documents. Make sure you have your document name and document description. And for your amendment form, your certification and licensure, and then the same thing for amendments, you want to make sure you date it. Whatever you name that file, make sure you date it. And then for the certification and licensure, for the amendments, you'll see, it'll have whatever you name the file, and then in the date. And so that will be right there. And so, but unfortunately, the way we're using this district document library with the approvals, Lindsay and Stephanie will send you an email letting you know that the the application has been approved, because GMap does not send notifications. We don't have from the district document library. If this was a funding type of application, the system is set up to provide notifications that way. So you will receive an email from Lindsay and Stephanie saying your annual application has been approved, and you can check GMap. And so for the quality assurances, I'm not sure, they haven't decided if they plan to create a template for that, but once that has been decided, notification will go out on what that process is regarding the quality assurances. And so whether it's a Word, Excel, or PDF file, you would just go through the same process of uploading, making sure you have a document name and a document description, and just uploading the file. Turn to District Document Library, click, and then go back here. And the assurances, and once again, it's date and time stamped. And so if you, by chance, one other thing is, if by chance you may have uploaded, your certifications and you forgot that maybe you realize that you failed to include some, what you can do is you'll go to the folder. So let's say here you forgot to add some of the certifications. You can just click delete. I'll just delete both of these. And you can upload it again. And here's the file. Now it deletes the file and it tracks everything that happened, because you'll see where I deleted the file. I deleted those two files, so it will track all of your steps and has a date and time. So if you forget something, or you mistakenly uploaded something, or you wasn't ready to upload it, you can delete it and upload it again. So it's pretty much a simple process of just uploading documents. So so that's the end of the demonstration. Does anyone have any questions about the process? I think Lindsay and Stephanie have already sent out the instructions, and they're just step-by-step instructions with screenshots of, what you should see during each step. But like I said, if you do not have GMap access, you will need to contact your district document library. Contact your user access administrator, which the list is in KDE resources. And if for some reason your district is not on the list, you can click on Contact KDE and either call one of these numbers or just email the KDE GMap email address, and it's two of us that monitor and manage that email address. So
what's next? Be cautious of contractual agreements. Please remember that Medicaid reimbursement is only meant to cover a small percentage of the school's actual cost. We want to make sure that schools don't get over their head and are making financially sound decisions when it comes to this program. For example, a practitioner may cost a district $80,000 for salaries and benefits, but the district may only recoup about $10,000 from Medicaid. Also, it will take at least 2 years for a school to see how much reimbursement they are getting. Remember, you get reimbursement through all 3 programs, and these amounts cannot be predicted. Please reach out to us if you have any questions or concerns. We're always here to help. Also, please stay in contact with your billing agents, and together we will navigate this new part of the program. One more exciting announcement. Our new updated SBHS Technical Assistance Guide, dual parental consents are now available on our KDE SchoolBased website. Be sure to check them out. We hope to see you this fall at our Medicaid trainings.
Later this summer, KDE will be conducting our next webinar to assist schools with the program expansion. So keep an eye out for our webinar, School-Based Best Practices. Also, we will be sending out an email we've already sent out the email for the annual applications. So if you have any questions or you have not received that, please reach out to our School-Based Medicaid email address and we will be able to get that sent to you immediately.
Here's everyone's contact information. Please, once again, if you need any help with anything or have questions, please reach out to Lindsay or I or Lucy Centers at the Department of Medicaid Services.
And here's our KDE School-Based Medicaid website. Please remember that our updated tag is available on our website along with this presentation. We hope to see everyone soon, and please stay healthy and safe, and we'll take any questions. If you guys have any, please send them over to that email.
Right now, we're not showing any questions. We'll give it a couple more seconds, and if not, we'll wrap it up. All right, it doesn't look like we're going to get any more questions. Thank you.
And if you guys decide you think of something to send, you can always send a question to that email address at any time, and we'll be more than happy to respond. Thank you all so much. Have a good day.